Hi, everyone. This is Kristen Petrie. I am the Director of Philanthropy for the John Ochsner Heart and Vascular Institute. And I have with me here today Dr. Charles Williams, our Domino transplant, and tell me the one other, it's Domino Liver Transplant, Domino Liver Heart Transplant. What was the other one? Your other claim to fame?
Combined heart and liver transplant.
Combined. Our
Combined
first
heart
and
and liver
only,
transplant and the Domino Liver Transplant.
and the Domino Liver Transplant, and that's our first and only here at Ochsner. And so, Charles, I know that we've talked a lot about your story and your journey at Ochsner, but please, if you don't mind sharing a little bit about how'd you get to our doors at Ochsner all the way from Florida?
Wow, I'll try and keep it brief, but it's such a long, involved story over such a short period of time. In 2016 is when I began, in the summer of 2016, I began my visits to Ochsner because of a congestive heart failure that I had developed. And my local doctors, including my local cardiologists, were unable to determine why I had congestive heart failure. They had placed me on congestive heart failure medications, but the medications weren't working. I was getting worse. At that point, they took me off all of my cardiac medicines because heart medicines that I was on, they were contraindicated for treating the congestive heart failure due to that cause. In fact, they could even make it worse. So they stopped the medications. And basically, the only thing that was available to treat me with at that time was diuresis, repeatedly draining the fluid off my body as it developed, and eventually a heart transplant if as I continued to deteriorate. And the literature was supporting the idea that indeed, from the time of diagnosis, I had about 2 to 3 years left to live. And the endpoint was rapidly approaching us for this. I was going back and forth to Ochsner during that time, and Ochsner was treating the diuresis. When it was severe enough, they were putting me in the hospital, draining the fluid. Other than that, repeating the studies and tracking the progress of it. However, everything came to a head in August of 2018. In August of 2018, I really started to go downhill. It was the point where I couldn't get out of my bed or out of my chair and walk from my bedroom to my bathroom without losing my breath, unable to breathe. And really, at that point, I did not know that if I could get the next breath, that I may have already have taken my last breath and it already may be over. I just waited. Fortunately, within a few seconds, I was able to take that next breath and I was going to live a little bit longer. So this happened multiple times and it became worse, much more frequent, much more often as the month progressed. By the end of August, in fact, on August the 31st of 2018, I had reached a point where I was completely drained. I had not been eating, I had not been sleeping. My body had no energy left. I had fought this for a month and it had drained me completely. There was just nothing left. And the thought of the next day going through the same thing all over again made me realize I could no longer do a next day. This is the last day I felt I could give to this. I really felt I could not give tomorrow to this disease. A lot of
So
prayer
the
was involved
only
in this
answer,
time.
and so the only, answer to this is going to be a transplant. And so how did that, when going through that process after August 31st, when did you hear that you were going to be getting the transplant?
Well, the transplant discussion had been off and on over that final year, especially over 2018, as I was dramatically becoming worse. They were first entertaining the idea of a heart transplant, and then there became the possibility of a combined heart and liver transplant in an attempt to actually completely arrest this disease, permanently arrest this disease by striking at its source within my liver, as well as the heart that was deteriorating, needing to be replaced.
Wow.
When I came in on August 31st into the emergency room of Ochsner, um, because again, how bad I was by that point and couldn't go any further, even to the next day, they assessed me, and within a few days of doing their best effort to try and keep me alive,
Hmm.
draining fluid off, trying to help me, putting in a, a, a pump, a balloon pump to assist my heart, even though in generally mechanical devices are known not to help this disease. But it was at a point of try something because, you have to do something. So it was
Wow.
really down to that. But 3 days later, he came back in my room. Actually, it was 2 days later. He came back in my room, my doctor, and said, "You won't believe this, but we may have a heart and liver for you." And
Wow. Wow.
I told him then, I said, "Unlock the wheels on this bed, roll me down to surgery, and put it in right now." I knew I
Right
had a week
now.
left. I really knew by the next week I probably was not going to be in this world any longer. I mean, it was to that
Wow.
point at that time in that first week of October. I did, there
Hmm.
was not a moment to waste. But he said, "No, no,
Hmm.
no, no. You know that we have to check compatibility. So for the next 8 hours, we will be checking compatibility and to see whether or not you match for it. But I remind you that most patients are not compatible with the first organ, and it may take several organs before they are. So I
Hmm.
can't
Right.
guarantee you're going to be compatible with this heart and liver." Um,
Hmm.
so I, you know, he said they were very blunt with me, very upfront the whole time I was at Ochsner because I am a doctor, a medical doctor.
Right.
So
Right.
they felt they could be more blunt with me, and I wanted them to be. And I was more blunt
Hmm.
with them in my conversations as we went back and forth in all of our visits, and especially during the time in the ICU. Next morning, he came in bright and early into my room and says, "You won't believe this. You are 100% compatible with that heart and liver, and we can now
Wow.
put it in you." And he said, "Now we can
Wow.
unlock the wheels on your bed and take you down to surgery." And that's when they rolled me out of the room and took me straight down. And for the next 12 hours, that's what they were doing. They were putting a new heart, new liver in me.
Wow. Wow. And I can't even begin to imagine the number of physicians that are in the room for one organ transplant, let alone two organ transplants. But I think that was such a beautiful reminder to all of us about how well and how coordinated care is done at Ochsner, across multiple service lines, across multiple specialties. Really, your story is the picture perfect one to showcase that. And that's just a really wonderful, wonderful thing. Um,
I want to tell you that my teams were superb. They were excellent. My heart transplant team, my liver transplant team, my cardiologists, my liver doctors, my hepatologists before the
mhm.
transplant, and all the other specialists saw, they all were very, very good to me, took care of me, very knowledgeable. They were upfront with me and kept me well informed, despite the research I was doing on my own through the literature to keep me informed
Mhm.
as well. I was thrown for another loop after surgery a few days later. The doctors, when they finally were able, they woke me up about 3 days after surgery, pulled the tube out and woke me up. And when they told me that about the surgery being successful, I was of course overjoyed that I had new heart, new
Mhm.
liver, and the surgery was successful, no complications. But what they told me next was more shocking, surprising to me than that. They said, "By the way, we were able to successfully use your liver to put it in someone else to save their life, and your liver is doing great now."
Wow.
So that was a shock because before surgery they mentioned the possibility, but the thought of it and discussion of it was pretty brief, so I didn't think much of it.
Mhm.
But after surgery, find out that my liver was good enough to actually be used in someone else to help save their life. I was shocked at how great I felt about that myself. I
Right.
don't know where it came from, but I
Right.
was the amount of exhilaration, being overwhelmed by hearing that news, was greater than when I heard that I had received a heart and liver myself. It was just tremendous that
Wow.
I was able to save someone else's life. But that brought in, he was in the room opposite from me, receiving, having his liver removed, my liver put in him by teams as well. Can you imagine how many
Right.
people
Right.
this must involve? The teams. Ochsner was probably at the height of what it does best on that day. Really was.
Yeah. Well, Charles, I will say that although it might surprise you that you were more ecstatic to hear that you saved someone else's life as opposed to when you were told your life was being saved, I'm not surprised at all that that was what you were most ecstatic about and getting to know you over the past few years. Your generosity, your spirituality, and your compassion for people just exudes from you, and it's seen by everyone that you interact with. Um, One thing is, I know
Thank you.
that you have given to, you're welcome. You have given to Ochsner in the past, both with your time, philanthropically, and quite frankly, advocating for us across the South as a place to receive your care. So I'd love to hear a little bit about, you know, what about giving back to Ochsner excites you, and why do you do that?
Well, it was never a question about giving back to Oshman. From the moment when I woke from surgery and found out what I had received, a new lease on life, a gift of life
Mhm.
restored to me. Basically, I saw myself as having died when they removed my heart, and yet they put in a new heart, and I was brought back to life by the procedures Oshner did that day. I
Mhm.
never ever thought about anything other than giving back to Oshner for what they had done for me, the great gifts they had provided to me that day. So that guided me. My wife and I have a history of giving for years and years to many, many causes, whether it's
Mhm.
our family, our relatives, whether it's other causes, in helping them out. So that wasn't anything new to us to start giving to Oshner. What was new is we just needed to find a way to give back to Oshner, to something that would actually
Mhm.
help, and something close to home, close to the cardiology transplant team, where we could indeed contribute to them. Uh, I was first approached by Ann Gilo about the transplant games,
Yes.
and how indeed donations supported those games completely, and she was really working hard to actually get me to agree to come to the games, participate in the games more than she was
For Team
about donating
Louisiana,
to the
right?
games.
Not Team Florida.
Yes. And that was still when I'm recovering. It's like one day, one day. But what was more
Yeah.
interesting to me was actually being able to give to the games and contribute to them.
Mhm.
And so immediately I started giving to the transplant games as a way of giving back to Ochsner, and helping
Mhm.
support those. But then recently, what came along was something I found out that Debbie Dumas Hicks, in the cardiology transplant clinic, had saw a
Mhm.
need to develop a really good quality uh, notebook, educational notebook for
Mhm.
cardiology transplant patients and their caregivers. And I was actually surprised when I first heard that, because from the time of my beginning of recovery out of surgery and going through rehab, the one thing I kept telling my wife is that we really need better material for cardiology
Mhm.
transplantation patients at Austin, a better notebook. They gave me several
Mhm.
notebooks. They were all less than high quality notebooks. The cardiology transplant team, good information aside, but they were missing something I saw from the liver transplant
Mhm.
team. The liver transplant team gave me a notebook, post-op for liver transplant, that was beautiful, high quality, full of color,
Mhm.
glossy pages, plenty of instruction laid out in a manner that was not only education, but kept my interest through the whole notebook and the way they did it. It was a superb work. And I said,
Material.
this is what they need over in cardiology
Mm-hmm.
transplant. They need their own notebook like liver transplant had. I understand at Ochsner, the Cancer Center has a really good notebook similar to as well.
Mm-hmm.
So I said, cardiology transplant really needs that. And I kept saying, how can we help them have that? So when I heard that Debbie was interested in developing that, I was absolutely
Mm-hmm.
flabbergasted. I said,
Yes.
finally, someone's going to run with that project and I can participate, I can
Yes.
contribute to it. So immediately I
And
said,
something that
let me give to that project. It
let
was
me
to
in.
you I know that. You told me about it. And I said, let me
Mm-hmm.
give to that project.
And something I love that the transplant team came up with, and to your suggestion was, how do we create a resource that's personal to the patient and their experience, and the caregiver that now is kind of thrust into this role that maybe they've never had at any point in their life, or maybe the only caregiving they did was you know raising children or caring for a parent, but to have your spouse go through something so traumatic, it's important that we give them the resources and the tools they need to succeed in taking care of you, and taking care of
Absolutely.
themselves.
Absolutely. I mean, I've spoken from my standpoint regarding the giving and what inspired me, but from my wife's standpoint, who was my personal caregiver throughout all of this and still is, my my wife has been to every one of my appointments at Ochsner.
Mm-hmm.
When I came into the hospital and was in the ICU for that 6 weeks, she slept in my ICU, in a bed in
Mm-hmm.
my ICU. She was there every day, all day with me for the full 6 weeks. Never
Mm-hmm.
left my side, caring and giving. I watched the wear and tear on her and how much it dragged her down and sapped the energy out of her to be there and
Mm-hmm.
support me through all that time. While I was there in ICU, I used to encourage her to go home, back to Florida, get a rest for a week or two, then come back if she really wanted to be back here, but go home and restore her energy. She wouldn't leave. She refused to leave. My children would come up and visit and go back. I tried to get her to go back with them. She wouldn't do it. But she was so drained by the experience. But she was
Right.
there diligently helping the nurses, taking loads off of the medical technicians,
Mm-hmm.
taking on things for me there to make their load easier, helping others, caring about things going out and getting things, bringing gifts back for the nurses from the local
Mm-hmm.
stores and treats for them. And the whole time, she was reading all of the material that cardiology was giving me after surgery, to before and after surgery, to read. She was reading all of it. And that was her education, her gaining it. But she had the
Mm-hmm.
same reaction when she saw the cardiology material versus what the liver transplant team had
Mm-hmm.
given us. And she felt the same way, that we really need to help cardiology transplant to develop a high quality product for education, not just for the patient, but also for the caregivers, as liver transplant has done with their notebook.
Right.
So she was
Because
fully
it is,
into it.
it's a journey together. It's you don't, oftentimes in healthcare we focus in and we hone in on the patient, and that is the reason why we're there, and that is so important. But I think it is such a testament to you personally, and to Gwen's caregiving, that we really saw this with the team of physicians and social workers and nurses as an opportunity to create something really beautiful at Ochsner, to support those that every day support our patients, which is the caregivers like Gwen. And it's been a wonderful thing to be able to even give them just a little peace of mind, at the bare minimum, through a project like this, that we're so excited to add to our arsenal of things that we have in our stellar cardiology program. So we are so appreciative of your generosity and everything you do to advocate for Ochsner. Again, every day, we couldn't hire a better person to advocate for us. So,
Well, I tell you,
but
I truly have been across the country giving my testimony since my
mhm.
surgery is done in multiple forums, small groups to very large groups. And every opportunity I get, I mention the name of Ochsner. I let them know where these miracles were performed and how appreciative I am of the fact that what Ochsner did for
Mhm.
me. So believe me, I get the
And
Ochsner
miracles
name out
is
there.
what they are. And miracle
Indeed.
that's a wonderful thing. And I can see our, in in such a crazy time that we're living in right now, it is so wonderful to see and hear such a beautiful story of generosity and gratitude. And it really reminds us of the things that are important in life, and things we should really be grateful for every day. And I know for me personally, that is my opportunity to meet you and hear your story every time. I am just amazed from the second I heard your story at a system leadership meeting many years ago, or I guess about a year ago, year and a half ago. It's just a truly wonderful thing. And I appreciate your openness and willingness to share that with us and the
Thank you.
world, and anyone else that's watching.
Thank you very much. Really appreciate that. You know, I have to be honest with you. Part of my spiritual philosophy on life is that God doesn't give me gifts, blessings to hoard, to keep to myself.
Hmm.
God gives me blessings to pass on to others. I'm only a conduit.
Absolutely.
They're given to me to pass through me to others, whether I pass them to my family, whether I pass them to relatives, whether I pass them to friends, whether I pass them to strangers, to other groups out there,
Hmm.
and definitely whether I pass them on to Ochsner. They're not for me to hold on to, for me to keep. You
Hmm.
know, I grew up in the projects in Florida.
Hmm.
I did not grow up
Right.
with. I grew up in the projects, and throughout life, I've always felt a guiding hand, and I felt a
Hmm.
responsibility over time as well. Oh, sorry about that. And I felt a responsibility over time as well that I'm not in this world just for me. I'm in this world
Hmm.
to serve, to give. And now I'm glad to see that the latest opportunity I have is really with the new program at Ochsner, a very beautiful
Right.
new program.
Yes. Well, you know what? I'll say that is a wonderful philosophy to take on life. And it is certainly one that I try to live by. And it is always a reminder anytime that you and I get to chat, of that exact reason while we're here, to be a conduit, to pass on greater good, and to make the place better, better than it was when we got here. So I know you're actively doing that, and our team that gave you a new lease on life uh, feels the same way. So I cannot thank you enough for coming and chatting with me today, and sharing something so beautiful. And I always learn something new every time I talk with you, and so I appreciate it.
Thank
So
you.
thank you so
Thank you
much,
very much.
Charles.
Thanks for giving me the opportunity.